I would have washed my hands before I entered the room. Hi, my name is Jennifer Willms. I'm a nursing student from Cedarville University. Today I will be doing trach suctioning and performing tracheostomy care. It should take about 10 minutes. Do you have any questions? Okay. Raise the head of the bed into high Fowlers. And normally for trach suctioning I would wear goggles, but I'm not going to wear them right now. I'm going to begin by doing trach suctioning. And the suctioning tube is packaged in my sterile gloves. So. And my glove rolled a little bit, so normally I would get a new pair of gloves and re-apply them. Open my sterile box. Suction catheter. So my non-dominant hand is now non-sterile. I would have, before I contaminated my left hand, I would have wrapped the suction tubing around my hand so that I could access it better. So I just contaminated it, but I wouldn't have done that normally. Turn on suction to continuous and attach the end to there. Test the suctioning. Prime it with water. Let it run through. And I would insert about 1 to 2 inches until the patient coughed. And then swirl around, and I would have an assistant hyperoxygenate the patient between rounds. Go again. Now I'm done with the suctioning. Turn that off, disconnect. And then I will remove the old dressing. And dispose of those. Get my tracheostomy care tray and the new cannula. Loosen the cap on my sterile solution. Apply my sterile gloves. And while I was suctioning, I would have informed the patient that if at any time they wanted me to stop, they could have raised their hand to signal that.
I need to keep, on the back of that, I need to encourage fluids,
Again, these gloves are contaminated. Way too big. Okay. I would have gotten a blanket to cover the patient's chest. Sterile drape. Dominant hand for sterile water. Put one 4x4 and some cotton swabs in there. Going to take this and remove the old cannula. And now the new sterile one. And now I'm using clean technique, not sterile technique. So I get my cotton swab and wipe around the stoma. Grab the wet 4x4 and wipe around the faceplate, making sure that everything is clean. Apply the new dressing bandage. Apply the new ties. I'm going to remove my gloves for this because they're too big and getting in the way. Secure it and remove the old one. Discard of this. Make sure the patient didn't have any questions or wasn't experiencing any pain. Lower the head of the bed. Give them their call light. Make sure the bed was locked, the side rails up. And that would conclude trach suctioning.